Hey everybody, let's talk about healthcare in America. It's a big, complicated system. Imagine a giant jigsaw puzzle with a million pieces. Some pieces fit, some don't. It can be confusing, right? We're going to break it down piece by piece. First things first, healthcare is how we stay healthy. It's about going to the doctor, getting medicine, and staying out of the hospital. But here's the thing, healthcare in America is expensive. And it's not always easy to get. Why is it so complicated? Well, there are lots of different players, hospitals, insurance companies, the government. It's like a three-ring circus, but instead of clowns juggling, it's your health and your money on the line. Let's try to understand this puzzle together, one piece at a time. Ready? Let's go. All right, let's talk hospitals. Think of them like different kinds of stores. You got your big box stores, your mom and pop shops, and everything in between. Hospitals are kind of the same. Non-profit hospital representative. First up, non-profit hospitals. They're like your friendly neighborhood store. They're here to serve the community. They don't aim to make a profit. They use their money to help people and improve their services. St. Jude Children's Research Hospital is a great example. They treat kids with cancer and rely heavily on donations. Government hospital administrator. Next, we've got government-owned hospitals. Think of these as the big department stores run by the government. They serve everyone, no matter what. The VA hospitals are a good example. They take care of our veterans. For-profit hospital executive. And then there are for-profit hospitals. These are like those fancy stores in the mall. They aim to make money. Now, there's nothing wrong with making money, but it does mean their focus might be a little different. They want to attract patients who can pay, and sometimes that means they might not offer all the services that other hospitals do. Now, let's talk about how we pay for all this healthcare. Remember that jigsaw puzzle? This is where it gets really tricky. One way is through private insurance. Think of it like car insurance, but for your body. You pay a monthly fee, and if you get sick or need to see a doctor, the insurance company helps cover the costs. Public insurance expert. Another way is through public insurance programs run by the government. There's Medicare, which is like healthcare for seniors, and Medicaid, which is for people with low incomes. Think of these as safety nets, making sure everyone has some access to healthcare. But here's the kicker. Even with insurance, you often have to pay some money out of your own pocket. These are called out-of-pocket payments. They can be deductibles, what you pay before insurance kicks in, co-pays, a fixed amount you pay for a visit or service, or co-insurance, a percentage of the cost you share with your insurance. And then there are other sources of funding, like charities that help people pay for their healthcare, donations to hospitals, and government grants for research and public health programs. It's a whole lot to keep track of, right?
Section 4. Universal Healthcare. What's the holdup? Now, you might be thinking, why is it so complicated? Why not have a system where everyone is automatically covered? Well, that's called universal healthcare. Many other countries have it. Think of it like public school. Everyone gets to go regardless of their family's income. It's just there, provided by the government. Sounds good, right?
So why doesn't the US have universal healthcare? It's a long story full of political debates, disagreements about the role of government, and concerns about cost. Some people think it would be too expensive or lead to longer wait times for care. Others argue that it would save money in the long run and provide better health outcomes for everyone. It's a big debate, and there are strong arguments on both sides. Section 5, Healthcare Headaches, Costs and Coverage. So what are some of the big problems with the US healthcare system? Well, two words: cost and coverage. First, let's talk about cost. Healthcare in America is expensive, really expensive. It's like going to a fancy restaurant and getting a bill that makes your jaw drop. And it's not just fancy treatments, even basic care can cost an arm and a leg. Second, there's the issue of coverage. Even though there are different ways to get healthcare, not everyone has access to it. Millions of Americans are uninsured, meaning they don't have any health insurance at all. That means they have to pay for everything out of pocket, which can lead to crushing debt or, even worse, avoiding necessary care altogether. It's a real problem, and it's one that policymakers are constantly trying to address. Section 6. The future of healthcare, work in progress. So where do we go from here? What does the future hold for the US healthcare system? That's the million-dollar question, folks. The truth is, nobody knows for sure. It's a work in progress, like that jigsaw puzzle we talked about. There are always new pieces being added, old pieces being rearranged. What we do know is that there are a lot of smart, dedicated people working hard to improve the system. Doctors, nurses, researchers, policymakers, they're all trying to find ways to make healthcare more affordable, accessible, and effective for everyone. It's a complex issue with no easy answers, but one thing's for sure. The conversation about healthcare in America is far from over.